Hi, my name is Dr. Paul Haggan. I'm the Crisis Coordinator with Argyle ISD, and I wanted to talk with you about depression and anxiety as it relates to our student population in hopes of helping you identify and support your children. Depression is fairly common in our student population, and it's that persistent feeling of sadness, loss of interest or meaning in life. And anxiety is just stress due to anticipating negative outcomes or something dreadful happening in the future. Common symptoms of depression are going to be the feelings of hopelessness, sadness, emptiness, irritability, anger, things like that. Loss of sleep, eating difficulty are common. Feelings of worthlessness or guilt. Self-blame is common too. What I see in a lot of kids is they get in these ruts where they're so negative about who they are and what their future looks like that it becomes pervasive and they begin to self-isolate. Probably a component that I didn't touch on is that feeling or sensation of being a burden on others. When they have that oftentimes provokes isolation or silence, and so that's an important one to investigate down the road. Some common symptoms in children and teens. I think some red flags would be things when children use the word weird, especially the younger ones. They just feel weird. They can't describe what their experience is, what they're feeling, and or if they think everything's stupid or if they're really critical and negative. If you notice those, then they're likely symptomatic of depression. They're common depressive disorders. One that's more common nowadays is disruptive mood dysregulation disorder, and that's where your child would be showing significant temper tantrums, anger outburst, irritability. Major depression is what we think of, the loss of interest in things, sad mood, isolation, some of those common symptoms of depression. Bipolar is shifts in mood, extreme highs or mania, and extreme lows or depression. Those are fairly common in our student population. Those at risk for depression and the things you might want to look for are low self-esteem, high degree of dependency, self-criticism or pessimism. Relationship difficulty is significant as well. If people are failing in relationships or struggling in relationships, then you might want to assume they're at risk for depression. If there's a family history or biology of depression, then that would indicate stronger possibility that depression could be occurring. Being gay, lesbian, bisexual, transgender, questioning in and of itself does not result in depression, but it's that unsupportive life situation. And that same case could be made for any population that feels marginalized or isolated. They're at risk for depression as well. If you have a history of mental health disorders, then you might be predisposed to depression as well. A lot of times our middle schoolers and more so our high schoolers will begin to experiment with alcohol and substances, and it turns out to not achieve what they wanted to achieve and can either result in depression or it could be viewed as a way to cope with depression. So we see a lot of experimentation along these lines in middle and high school too. Recreational drugs. And if there's a chronic condition, a lot of times you're susceptible to depression as well. So I've had students with back problems who could no longer cheer or play football, and so they're that loss of identity associated with an activity that they've been involved in for years can trigger depression. Complications related to depression could be things like eating disorders. That starts to become more common. Children experiment with appearance and acceptability or worth, and so they'll either try to gain weight and or lose weight to fit an ideal. Oftentimes individuals with depressive symptoms have low pain tolerance or physical conditions, physical illnesses. They experiment with alcohol and drugs again. A lot of times there's anxiety, high anxiety associated with depression. And family conflict, as I said earlier, relationship difficulties set the stage for depression as well. Suicide becomes more prevalent, and so I would encourage you to investigate that. Don't be afraid to ask if they are thinking of hurting themselves, or if they have hurt themselves or are considering hurting themselves, and if so, how and how often. You know, a lot of times our kids will cut, or they'll take an eraser and rub on their skin to cause sort of a burning appearance on their body. And so, but self-injury such as cutting is common in middle and high school as a way to cope with depression. Depression, I believe, results from discouragement, which is when you lose faith in your ability to achieve in an aspect of your life. You start to think negatively of yourself, situation, and future, which is the cognitive triad of depression. And an oversimplified solution would be to find courage or faith in a challenge or task and think positively of yourself and apply that to a situation so that you have a sense that your future will be better. So that's a gross oversimplification, but relevant to depression. Prevention of depression revolves around the lines of reducing stress, increasing resilience, allowing for self-forgiveness, increasing belonging and self-esteem. So if your child you suspect has depression, it would be important to address all of those. You know, and I'd reach out to family, friends. You'd be surprised at how many people have struggled with it or know someone who has, and get treatment as early as possible. And don't be surprised if treatment goes a lot slower than you would have expected. Anxiety stems from you interpreting something in the future as being awful or dreadful. So that creates those symptoms. Oftentimes you'll see panic, doom, dread, sleep problems, eating problems. Some will indicate they have tingling sensation in their hands or their limbs. They have breathing problems. Some may even feel heart palpitations if the anxiety gets high enough and they think they're having a heart attack. But nausea, muscle tension, dizziness are common, as is rumination. Just keep running those thoughts over and over and over in your head. And kids with high anxiety often are misdiagnosed with ADHD because they have difficulty concentrating or finishing tasks. And oftentimes they avoid feared scenarios. If it's a project or an individual or a class, they tend to isolate. There are many different types of anxiety. There's generalized anxiety, which is your basic worry, or could be over a number of things. Phobias are irrational fears of things that typically are not dangerous. And then panic disorder is a heightened sense of anxiety. It's when you exceed a threshold to cope and you feel like you're going to die, having those heart palpitations, difficulty breathing. And it's an extreme form of anxiety, often irrational in nature as well. Risk factors: if you have a history of mental illness in your family or mental health issues, childhood trauma, could be neglect, abandonment, abuse of any form, either physical, emotional, or sexual abuse. I see kids who, they're shy or have low self-esteem, and they're thrust in situations where they're supposed to be gregarious, outgoing, engaging, and it simply isn't within their character makeup, or they're just not comfortable in that setting. It heightens that sense of anxiety. Anxiety, an oversimplification of anxiety can be seen in fear. Fear is an acronym that for fantasized experiences appearing real. It's a cognitive process. It's how you think that results in how you feel. And so what kids and everyone tends to do is you tend to think that a task is big, your ability to resolve that task is small, and that the outcome will be negative. And so that creates anxiety. So an oversimplified resolution to that would be to break down the task, develop or utilize a skill to produce a positive outcome. And so play to win rather than play not to lose in those situations. And that's a little bit of what I just discussed. And the old saying is action's the enemy of anxiety, so I encourage people not to avoid. But that's oftentimes what we inadvertently recommend. So if you're having trouble with school, let's avoid school, or trouble with an event, then you avoid that event. And it doesn't resolve the problem; it actually perpetuates it. Prevention, once again, manage stress, increase resiliency and self-esteem. Reach out early, get support from family members or those capable of treating. And I will say that our district has exceptional counselors and exceptional assistant principals who are trained in dealing with all of these symptoms and can be highly supportive. I look at us as a multidisciplinary team and equipped to identify and support kids with both anxiety and depression. So reach out early and coordinate. We like to collaborate with outside therapists and groups and parents and apply those skills in our school setting. Treatments can include a medical or psychological evaluation, cognitive behavior therapy. Systematic desensitization is successive exposure to increasingly feared stimuli, and so you just get closer and closer to resolving a pervasive fear. Sleep is important, and if a student's been out with anxiety or depression, a re-entry plan that is critical. Takes into account not only their symptom, but also how they've coped and how they can apply that coping when they return to school. We want to reestablish routine and structure, train them to relax, oftentimes partner with someone. Exercise and social skills training go hand in hand with anxiety reduction and anxiety management. And sort of in conclusion, what can you do as a parent or as a caregiver? I really want you to think about talking to your children every day. Really taking the time to have uninterrupted engagement with those kids. Relate with your children in their world. Validate their experience and their existence. You don't have to agree or approve of everything they're doing, but you really want to be affirming of who they are, what they're doing. Talk about some of the joy and the children's role in creating that joy for themselves. Ask about disjunctive feelings, which are the sadness, the anger, the anxiety, the guilt, and the confusion. Really, you can pick one or two a day. Just say, tell me something that's breaking your heart, or talk about something that didn't go as expected, or to really dig in, or something that upset you today. But you really want to empathize with them, and that's seeing their world from their eyes and be affirming of that. And then lastly, happiness isn't the absence of problems, but it's the ability to deal with them. That's what I want to participate with you in helping your children develop skills to cope with anxiety and depression. I'd like to partner with you on that. And just in conclusion, I think we have a lot of resources on our web pages, and feel free to reach out to any teacher, administrator, counselor. We'd like to support you or collaborate with you in helping your children cope. Thank you.